Welcome to the deep dive. Today we're plunging into a topic that, well, casts a long shadow for so many. Cancer.
Mm-hmm.
It's a word we all know, and the numbers are pretty stark. The World Health Organization tells us around 10 million people die from it every year.
Yeah, it's actually the second leading cause of death globally, right after heart disease.
Exactly. It's a huge global health challenge.
Immense, really.
So our source for this deep dive is a really comprehensive overview titled Comprehensive Guide to Cancer: Causes, Symptoms, Treatments, and Prevention Strategies.
It's a great resource, almost like a cheat sheet for this complex illness.
That's a good way to put it. And our goal today, for everyone listening, is really to pull out the most vital knowledge, not just the what, but the why, and hopefully give you insights that could actually, well, make a difference.
Yeah, the aim is to cut through some of the noise, maybe offer a clear perspective on what's happening at a really fundamental level.
Okay, sounds good. So let's dive right in. How does cancer actually get started? And maybe more importantly, why is it such a serious threat?
Right. Well, at its heart, cancer is basically a story of cells behaving badly. Normally, our cells have this very strict life cycle.
They grow, divide, die off when they're supposed to.
Precisely. They follow the rules. But with cancer, certain cells they throw out the rule book. They start multiplying without any checks or balances.
So it's like a kind of cellular mutiny.
That's a perfect way to think about it. And these rebellious cells, they don't just overpopulate their own area, they can actually invade and damage the healthy tissues around them.
Okay.
And even more critically, they often figure out how to spread to distant parts of the body. That's the process we call metastasis.
Ah, metastasis.
Yeah.
Heard that term, like seed spreading.
Exactly like that. The original tumor is the main plant, and metastasis is like its seeds being carried off to grow somewhere else entirely.
And I imagine that ability to spread is a huge part of why it's just so difficult to treat sometimes.
Absolutely. It's a major factor. So the question then becomes, what actually triggers this cellular rebellion in the first place?
Right. What starts it?
Our guide points to several key things. First off, genetic mutations. Think of our DNA as this incredibly complex instruction manual for our cells.
Okay.
Sometimes errors happen when that manual gets copied. These are mutations. Now, some are harmless, like little typos, but others can mess up really crucial instructions, like the ones telling a cell when to stop growing. And these mutations, they can be inherited, meaning you're born with a certain predisposition, or they can be acquired during your life.
And those acquired ones often come from our environment or lifestyle, right?
Exactly right. Which brings us neatly to the second cause, carcinogens.
Okay.
These are basically external things that can damage that cellular instruction manual, the DNA. Classic examples are tobacco smoke, UV radiation from the sun, even substances like asbestos.
Things we're often warned about.
Yeah, they can directly alter the DNA, making those growth-related mutations more likely.
Makes sense. What else is in the mix?
Chronic inflammation is another important piece of the puzzle. So if you have inflammation that lasts a long, long time...
Like from an ongoing infection or condition?
Yes, exactly. That state can actually create an environment inside the body that encourages cancer cells to develop and multiply. The guide uses the example of chronic hepatitis leading potentially to liver cancer.
Interesting. So it's not just direct damage, but the body's response creating favorable conditions.
That's a key point. It's the sustained state of alert, almost, that can inadvertently help cancer get a foothold.
Fascinating distinction.
It is. Then we also have certain viruses and infections.
Right. I've heard of this link.
Yeah, viruses like HPV, human papillomavirus, hepatitis B and C, and even a specific bacterium, Helicobacter pylori. These have all been strongly linked to increased risk for certain cancers.
How do they do that?
Well, the thinking is they might integrate their own genetic material into our cells, or they might cause that chronic inflammation we just talked about, basically setting the stage for cancer.
Okay, quite a range of triggers then.
Yeah.
And the last one mentioned was hormonal factors, like estrogen in some breast cancers.
Exactly. Certain hormones can act almost like fuel or growth promoters for specific cancer types. If the body's delicate hormonal balance gets disrupted, that can contribute to the development or progression of those hormone-sensitive cancers. It's often a complex mix of these factors, not just one thing.
Right. Rarely just one simple cause. Okay, so we've got a clearer picture of how this uncontrolled growth begins. Now, the big question. Why is cancer still such a formidable killer, despite all the medical advancements?
Yeah, that's crucial. And there isn't one single answer. It's several interconnected things. A major hurdle is late detection.
Uh,
As the guide points out, some really aggressive cancers, think pancreatic, ovarian, even some lung cancers, they often don't cause obvious symptoms in their early stages.
the stages where they'd be most treatable.
Exactly. It's like a fire spreading silently behind the walls before any smoke alarm goes off.
That's a really sobering thought. The disease could be progressing without you even knowing.
It is. And then, as we mentioned earlier, there's metastasis.
The spreading.
Right. When those cancer cells break away from the original spot and set up shop in vital organs like the brain, liver, lungs, bones, it becomes exponentially harder to get rid of all the cancer cells. You're not fighting on one front anymore.
Because you're dealing with multiple outposts throughout the body.
Precisely. The cancer has established these new colonies. Then there's the really frustrating reality of treatment resistance.
Meaning the treatments stop working.
Yeah. Unfortunately, some cancers can develop resistance to our main therapies, chemotherapy, radiation, even some of the newer immunotherapies. It's almost like the cancer cells learn how to dodge the attacks or repair the damage.
So a treatment that might work initially could become ineffective over time.
That's a significant challenge, yes.
Hmm.
The cancer cells adapt, they evolve, basically.
Right.
And our guide also really stresses the huge impact of lifestyle and environmental factors. Take tobacco use. It's implicated in something like 22% of all cancer deaths.
22%, that's huge, more than 1 in 5.
It's an enormous proportion. And the links between, say, obesity and poor diet to cancers like colorectal and breast cancer are becoming clearer and clearer.
Mm-hmm.
Same with excessive alcohol. It definitely increases the risk for liver, esophageal, and other cancers. And then you have environmental exposures. Pollution, certain industrial chemicals, radiation sources like asbestos, or too much UV from the sun. These all add to the overall burden.
So while genetics definitely plays a part,
It does.
it sounds like many really significant factors are things we might be exposed to or related to how we live.
That's a really important takeaway. It's not all just inherent bad luck. Many factors are potentially modifiable.
Right. Okay, that helps explain why it's such a challenge. Now, let's maybe pivot to some specific types.
Mm-hmm.
The guide has a useful table outlining common ones and their typical warning signs.
Yes, and it's important for listeners to be aware of these. But, and this is crucial, remember these symptoms can also be caused by many other much less serious conditions.
Definitely. This isn't about self-diagnosing or panicking.
Not at all. It's about being informed, knowing your body, and knowing when it's time to check in with a doctor.
Absolutely. Empowering, not alarming. So, what are some key things the guide highlights for, say, lung cancer?
Okay, for lung cancer, which is still a major killer, the guide mentions symptoms like a cough that just won't quit, maybe coughing up blood, chest pain, or feeling short of breath.
Things you probably notice.
Hopefully, yes. For breast cancer, which affects so many women and some men, potential signs include finding a new lump or thickening in the breast area, changes to the nipple like discharge or turning inwards, or maybe skin dimpling, looking like an orange peel.
Okay, and prostate cancer. Common in older men, right?
Yes. Symptoms there might include trouble urinating, starting, stopping, weak flow blood in the semen, or sometimes erectile dysfunction.
Important things to be aware of. What about colorectal cancer?
With colorectal cancer, the guide lists things like blood in the stool, which might make it look dark or tarry, or you might see bright red blood, unexplained weight loss, and persistent changes in bowel habits, like diarrhea or constipation that lasts more than a few weeks.
Okay, and skin cancer,
Mm-hmm.
particularly melanoma, the serious kind.
Right. For melanoma, the key is looking for changes in moles. Remember ABCDE, asymmetry, irregular border, uneven color, diameter larger than a pencil eraser, and evolving or changing over time. Also, any mole that starts itching, bleeding, or just looks different.
That ABCDE rule is handy.
It is. Now, pancreatic cancer, you mentioned it's often caught late. What are the signs there?
The guide notes jaundice, that's the yellowing of the skin and the whites of the eyes, as a potential sign. Also, severe pain in the upper abdomen that might spread to the back, and significant weight loss without trying.
Those sound quite serious.
They can be. And finally, for leukemia, which is a cancer of the blood cells, common symptoms often include feeling really tired all the time, getting frequent infections, and bruising or bleeding easily.
Again, it's so important to stress none of these symptoms automatically means cancer.
Absolutely not.
But they are signals. They're your body telling you something isn't right, and it warrants a conversation with your doctor. Getting things checked out early can literally be life-saving.
Couldn't agree more. Early detection is just so critical for improving outcomes. So, how do doctors actually diagnose cancer? What tools do they use?
Well, there are several key methods. Imaging tests are very common, things like X-rays, CT scans, MRIs, PET scans. These give doctors pictures of the inside of your body.
Different ways of looking inside, basically.
Exactly. Each one offers a slightly different view, helping to see the size, shape, and location of anything suspicious, like a tumor.
And there's the biopsy. That often sounds like the definitive test.
It often is. A biopsy involves taking a small sample of tissue from the area they're concerned about. A pathologist then looks at that tissue under a microscope.
To see if cancer cells are actually present.
Yes, and if so, what specific type of cancer it is. That's usually the most reliable way to confirm a diagnosis. Blood tests can also give important clues.
How so?
They might look for specific substances called tumor markers, which some cancers release into the blood, or they might look for genetic changes linked to cancer. And sometimes procedures like endoscopy are used.
Like a colonoscopy.
Exactly. Colonoscopies for the colon, bronchoscopies for the airways and the lungs. These use a thin tube with a camera to let doctors look directly inside certain organs and take biopsies if they see anything abnormal.
Got it. And the guide also really emphasizes recommended screenings. These are for people without symptoms, right? Trying to catch it super early.
Precisely. These are proactive checks for common cancers in people who are generally considered average risk, aiming to find cancer or precancerous changes before they even cause symptoms.
Makes sense. What are some examples?
Well, for breast cancer, regular mammograms are typically recommended for women, usually starting somewhere between age 40 and 50. The exact timing can depend on guidelines and individual risk. For colorectal cancer, screening like colonoscopy is generally advised starting around age 45 or 50 for average risk folks.
And for cervical cancer?
That's usually screened for with pap smears and increasingly HPV tests as well, done at regular intervals, maybe every 3 to 5 years for most women within a certain age range.
Right.
And for prostate cancer, the PSA blood test, prostate-specific antigen might be discussed, especially for men at higher risk, but it involves a conversation with the doctor about the pros and cons.
So these screenings are like a safety net, really. A crucial layer of defense.
Definitely. Okay, so let's say cancer is diagnosed. How is it treated? It sounds like the options are expanding.
They really are. And the absolute key thing to understand is that treatment is highly personalized now.
Not one size fits all.
Not at all.
Yeah.
It's tailored to the specific type of cancer, how advanced it is at stage, and also the patient's overall health and even their preferences.
Makes sense. So what are the main approaches?
Well, surgery is often a primary treatment, especially if the tumor is contained in one area and hasn't spread much. Think early-stage breast, prostate, colon cancers. Removing the tumor is often the first step.
Okay, cutting it out.
Right. Then there's chemotherapy, which most people have heard of.
The drugs that kill cancer cells.
Exactly. Chemo uses powerful drugs, usually given intravenously or as pills, that travel throughout the body to kill rapidly dividing cells. It's effective for many cancers, but because it affects any rapidly dividing cells.
That's where the side effects come in, like hair loss, nausea.
Precisely. Healthy cells like hair follicles, cells lining the gut, they divide quickly too, so they can be affected. Then there's radiation therapy.
Using high-energy beams?
Yeah, like X-rays or protons, precisely aimed at the tumor to destroy cancer cells in that specific area. It could be used alone, or maybe before surgery to shrink a tumor, or after surgery to kill any remaining cells. Sometimes it's combined with chemo.
A localized attack, unlike chemo, which is body-wide.
Generally, yes. Now, we've also been hearing so much about immunotherapy lately. How does that work?
Immunotherapy is really exciting. It's a different strategy altogether. Instead of attacking the cancer directly, these treatments work by boosting the patient's own immune system.
Helping the body fight the cancer itself.
Exactly. Essentially taking the brakes off the immune system so it can recognize and kill cancer cells more effectively. It's shown amazing results in some cancers like melanoma and certain lung cancers.
That's fascinating. Harnessing our own defenses. The guide also mentions targeted therapy. How's that different from chemo?
Targeted therapies are more precise than traditional chemo. They focus on specific weaknesses within the cancer cells, maybe a particular gene mutation or an overactive protein that's driving the cancer's growth.
So to attack something specific to the cancer cell.
Ideally, yes. For example, there are drugs called HER2 inhibitors used for breast cancers that have too much of the HER2 protein. Hormone therapy is another type of targeted approach, used for cancers like prostate and some breast cancers that need certain hormones to grow. The therapy blocks those hormones.
More specific targets, potentially fewer side effects on healthy cells.
That's often the goal, yes. And finally, the guide mentions stem cell transplants. That sounds pretty intense.
It is quite intensive. Stem cell transplants, sometimes called bone marrow transplants, are mainly used for blood cancers, leukemias, lymphomas, multiple myeloma. How do they work?
Basically, they allow doctors to use very high doses of chemo or radiation to wipe out the cancer cells in the bone marrow. Then, healthy stem cells either collected from the patient beforehand or from a donor are infused back into the patient to rebuild a healthy blood and immune system.
A complete reset of the system, almost.
In a way, yes. It's truly remarkable how diverse and, frankly, sophisticated cancer treatment has become.
It really is. And speaking of progress, the guide touches on some really exciting breakthroughs happening in research right now.
Absolutely. Things are moving fast. One of the most talked about areas is CRR T-cell therapy.
Right, training the immune cells.
Kind of. You take a patient's own T cells, a type of immune cell, genetically engineer them in the lab to specifically recognize a target on their cancer cells, grow millions of them, and then infuse them back into the patient. They become living drugs, essentially.
Wow. That sounds like science fiction.
It almost is, but it's real and working for some blood cancers. Precision medicine is another huge area.
Tailoring treatment based on genetics.
Exactly. Using detailed information about an individual's genes and the specific genetic makeup of their tumor to choose the treatments most likely to work for them. It's moving away from treating lung cancer and towards treating Jane Doe's specific type of lung cancer with these particular mutations.
That makes so much sense. And I've heard about liquid biopsies, too. Less invasive.
Yes, liquid biopsies are a massive area of development. The idea is to detect cancer cells, or fragments of their DNA or RNA, that are shed into the bloodstream or other bodily fluids.
Just from a blood test.
Potentially, yes. This could allow for much earlier diagnosis, for monitoring how well a treatment is working without needing repeated invasive biopsies, and maybe even detecting if cancer has come back sooner. It's a real potential game changer.
That would be incredible.
And don't forget the role of AI and machine learning.
How does that fit in?
AI is proving invaluable for analyzing huge amounts of data, looking at scans to help detect subtle signs of early cancer, analyzing genomic data to identify new drug targets, predicting treatment responses. It's accelerating research and improving clinical practice.
These advances really do offer a lot of hope, don't they?
They absolutely do.
Yeah.
Which leads us nicely into something incredibly important: prevention. The guide makes a really powerful statement. Up to 50% of all cancers might be preventable.
50%. Half. That's staggering.
It really is, and it underscores how much power we potentially have. The guide outlines several key strategies, starting with lifestyle changes. Top of the list: quitting smoking.
We knew that was coming.
Of course. It dramatically lowers the risk not just for lung cancer, but throat, bladder, pancreas, kidney. The list goes on. Limiting alcohol is also key. It reduces the risk for liver, breast, esophageal, and other cancers.
Okay. What about diet? We hear a lot about cancer-fighting foods.
Well, while no single food is a magic bullet, the overall pattern matters. A diet rich in fruits, vegetables, whole grains, and legumes, and lower in red and processed meats and sugary drinks is consistently linked to lower cancer risk, especially for colorectal cancer.
So a generally healthy, balanced diet.
Exactly. And regular physical activity is another big one. Exercise helps lower the risk for several cancers, including colon, breast, and endometrial cancer. Plus, it helps maintain a healthy weight, which is also important.
Right, the obesity link we mentioned earlier.
Precisely. Beyond those lifestyle choices, the guide also highlights vaccinations.
As a prevention tool.
Yes. Vaccines are amazing tools against certain virus-caused cancers. The HPV vaccine is incredibly effective at preventing most cervical cancers, plus some vaginal, vulvar, penile, anal, and throat cancers caused by HPV.
That's huge.
It is. And the hepatitis B vaccine significantly reduces the risk of developing liver cancer later in life, since chronic hep B infection is a major cause.
So vaccines are direct cancer prevention in these cases.
Absolutely. And then, of course, sun protection.
Preventing skin cancer.
Right.
Yeah.
Using broad-spectrum sunscreen, wearing protective clothing, seeking shade, avoiding tanning beds, all crucial for preventing melanoma and other skin cancers caused by UV radiation.
Makes sense.
And finally, the guide brings us back to the importance of those regular screenings we talked about.
Catching things early.
Exactly. Even if you feel perfectly healthy, participating in recommended screenings for your age and risk group mammograms, colonoscopies, pap tests is one of the most effective ways to catch cancer early, when it's most treatable and often curable. Early detection really does save lives.
So it seems there are many, many proactive steps we can take. It's not just about waiting for treatments, but actively reducing risk.
That's the crucial message, yes. Now, for those who are currently living with cancer, the guide also briefly touches on support and care beyond the purely medical treatments.
Because it affects everything, not just the body.
Exactly. Palliative care is mentioned, and that's not just end-of-life care. It's about managing symptoms like pain, nausea, fatigue, and anxiety at any stage of a serious illness to improve quality of life.
That's an important distinction.
Very important. Support groups are also highlighted. Connecting with others who understand what you're going through can provide immense emotional and psychological support for patients and their families.
Shared experience helps.
It really does. And things like nutritional counseling to help manage side effects and maintain strength, and physical therapy to regain function and reduce fatigue. These are all part of a holistic approach to care.
Looking after the whole person, not just the disease.
Precisely. It recognizes the multifaceted impact of cancer.
Okay, so as we start to wrap up this deep dive, drawing from our source, the Comprehensive Guide to Cancer, what are the absolute key takeaways, the things we really want listeners to remember?
Right. The guide really hammers home a few critical points. First, know the potential symptoms.
Be aware of your body.
Yes. Be aware, and if you notice persistent or worrying changes, get them checked out promptly. Early detection saves lives. That's maybe the single most important message regarding symptoms.
Okay, what else?
Second, adopt a healthy lifestyle. Remember that statistic up to half of cancers might be preventable. Choices about smoking, alcohol, diet, exercise, sun protection, they really matter. They can significantly stack the odds in your favor.
Empowering, very.
Third, stay up to date with recommended screenings. Don't put them off. Regular checks improve outcomes dramatically by finding cancers early.
Be proactive.
Exactly. And finally, fourth, keep hope. Research is advancing incredibly fast. New, better, more targeted treatments are emerging all the time. The landscape of cancer care is constantly improving.
That's a great summary. Know the signs, live healthy, get screened, and stay hopeful. Because progress is happening.
That's it in a nutshell.
It's a powerful reminder, isn't it?
Mm-hmm.
While cancer is undeniably a major health challenge, we're far from helpless. Knowledge, awareness, action, both individually and collectively, can make a huge difference.
Absolutely. The ongoing progress in understanding, preventing, detecting, and treating cancer really does offer genuine hope.
So for everyone listening, as you process all this information from our deep dive today, maybe just take a moment. Think about those prevention strategies we discussed. Is there one, maybe small, actionable step that feels relevant to your life right now, something you can potentially incorporate?
Mm-hmm.
It really is about empowering ourselves with this knowledge and recognizing that we do have some agency in navigating this complex health issue. The fight against cancer continues, but understanding is a powerful weapon.